My name is Dr. Tracee Short, and I meet people on the worst day of their life. No one ever plans to need myself or my team's services. When they land in the burn center, they've lost it all. Some have lost loved ones, some have lost all of their worldly possessions, and many have lost an image of who they are. When they land in our burn unit, our job and my team is to restore hope, and we do that with one bandage, one surgery, and one encouraging word at a time. When people land in the burn center, they typically spend about 1 day per percent burned with us. That means that they get to become a part of our family and we get to become a part of theirs. We get to see them through their low moments as well as continue to restore hope, and we have a decent period of time in which to do this, unlike in other areas of the hospital. First, I'd like to introduce you to JW. JW is a patient who had been burned 36 years prior to me meeting him. He is the epitome of why our patients mean so much to us. JW became a member of the family, and in becoming a member of the family, he has shared with us his story and how he triumphed. JW, by any measures of success, actually was a medical miracle. 36 years ago, you have to imagine that the technology is not what it is today, and he survived. We cheered, and we were like, yes, JW made it. But JW on the inside had lost a sense of who he was. JW found himself standing on a bridge on the brink of suicide in a foreign body, not knowing what he was to do. It was in those moments on the bridge that JW realized that he must have survived for some reason, and he was going to work to determine what his purpose and his mission was. This is how I came to know JW. JW is a member of our family. He is that person who determined that his purpose was to give back to others who had been burned. So whenever we have a patient or a family who's going through a trauma, they're not handling the news well, they're uncertain as to what the future looks like or if there's a future at all, JW is our first phone call. He's able to provide that insight as a survivor to give the hope and to give the promise that there is a new normal and that things do get better. The next person I'd like to introduce you to is a patient who has taught us that technology is amazing. It has allowed us to show all that our burn center is capable of doing. Her name is Miss Cecile. Miss Cecile is a sassy 80-year-old woman who ended up in our burn unit after she ran over her leg with her own car. Yes, it's okay, there's no elephant in the room. She laughs at it herself. Let's just say Miss Cecile forgot to put the car in park, and as she was getting out, it started to roll, and in her spry 80-year-old's body, thought she could put it back in car from the outside, stumbled, and the rest is history. I tell you about Miss Cecile because she actually ended up at a hospital not here in Baton Rouge, but the only option that they gave her was amputation of her leg. So for an 80-year-old vivacious woman, the idea of losing her leg over something she called so stupid did not rest well with her nor her family. So they started researching where they could go to take care of her skin problem. So they looked and they found the best, and they came to Baton Rouge General because we are experts in skin. So we utilized 3 areas of technology in order to get Miss Cecile better. We used vacuum therapy, biologic tissues, and spray skin. What? Yes, I know. Y'all all said it, and we'll break it down one therapy at a time. So, with vacuum therapy, it's not like the Hoover or the Dyson, but it's kind of like it. Essentially, it's a device that was patented by a plastic surgeon, and it provides a continuous suction on a wound bed. And in that continuous suction, it helps to bring blood flow to the area, it decreases bacteria, so therefore it decreases their risk of infection. It can actually be used to wash wounds out, and essentially it helps to fill in defects. Vacuum therapy. Biologic tissues. Well, biologic tissues is what's necessary when you have more than just a skin problem. Imagine it kind of like gardening, and your skin is the topsoil. If you have a defect that goes all the way down to that clay layer, you can't just fill it with topsoil. So we use things like biologic tissues. They can come from a cow, they can come from pigs, Icelandic cod, man-made polymers, and actually even other humans. The irony when it comes to biologic tissues is we can even utilize the amnion, that sac that the baby sits in during a pregnancy. We can use that thin sac to help augment burn wounds. And as of late, you want to talk about farm to table. As of late, we actually created a program with our own birth center where moms here at the BRG, I might be using some amnion that came from them and augmenting the burn wounds in my burn center. Amazing. Spray skin technology. It's kind of exactly like what we say. One of the downsides to my job is that in order to get one wound better, I have to create another one. That other one is the one that people complain about for years. When you come to our burn banquet, every single survivor talks about the pain that they went through from having a donor site. Well, with spray skin technology, it has changed that. In the past, if I wanted to get a wound, say, on your thigh healed, I'd have to take another piece of skin the length of your thigh and move it in order to make you better. But now, instead of a strip of skin, I can actually take a postage stamp size of skin, and that postage stamp will cover that same area. It's pretty amazing. So all three of these things we utilized to help Miss Cecile get her leg back together so that this 80-year-old spunky woman can get back to driving and doing what other 80-year-old women do. I love what I do here at the BRG, and here's part of the reason why. Unlike most hospitals, there's only 125 burn centers in the entire country, and only 66 of them are verified. What does that mean? As a verified unit, our job and task is to work on the reconstruction, the rehabilitation, the recovery and restoration of someone after a burn wound. We don't simply take care of people's skin. We use those 4 principles and we then apply those to how we can keep you well, including things like physically, socially, mentally, occupationally. Our job is to get you back to your new normal. And so one of the things that we do really well is we can address this problem great in kids. When it comes to the kids, we have innovative programs where we work on reintegrating them back into school, where our social worker will go and talk to their class and their teachers to prepare them for what to be expected when the child returns to school. We do it through fostering good body image, through things like burn camp, where we teach them how to improve their new body image and introduce it back into the world. We also help with role play in teaching them how do you have that conversation when you catch someone staring or someone asks questions that you're not prepared to answer. We do it well. There's 30 years of documented evidence about the importance that burn camps play in the roles of our pediatric burn patients. Burn camp allows for you to get into those nitty-gritty situations that you can't get to in a very quick office visit. It allows you to delve deeper into what's going on. Now with that, I'd like to segue away from the kids because there's so much data on the kids that the next patient will kind of illustrate where I learned that I had some room for improvement. My next patient, we're gonna call him Jason. He spent almost 3 months with us due to his burn injury. And I was talking to him in the office now 1 year after being healed. And we went through the normalcies of a visit. How's your wife? How's your kids? Are you having any pain? Are you having any itching? We were getting fine. And then when I touched on, have we gone back to work? Has your life gone back to normal? And he hesitated. And it was in that hesitation that I realized that something was wrong. And so then I started probing even deeper. When we started touching onto the relationships of things, I found out that Jason and his wife had actually not been intimate in any way in the full year since he had healed from his accident. When I kind of got into, what did he think was going on, he felt that his wife, because she had been with him during these periods of time when you really couldn't touch him because he was fragile and he hurt and was difficult to move, she felt that she would hurt him. In his mind, he felt that she didn't see him as the man that he used to be. But then it wasn't just a relationship problem with his wife, because I found out that he would go to Little League events with his daughter, but he would sit in the car because he didn't want the kids to perceive him as a monster. I failed. I failed Jason and the other patients like Jason. I was so into making certain that the kids had what they needed because these formative years are what was essential in how they were going to interact with the world and with their peers, and forgot that adults have problems too. Adults need that fostered environment where they can talk to other people who've been what they've been through, that provides you that intimate environment where it's just you, other survivors, spouses, and family to kind of get into that nitty-gritty that you don't get to talk about in the doctor's visits. Jason helped elucidate that just as important as burn camps is for kids, it is for adults. So one of the things that I then vow is that in addition to providing these outreach activities for our kids, our adults need to be right there with them. So in the future, when I come and I chat with you and I tell you about Jason and I introduce myself, I will let you know that I am Dr. Short. I do meet people on the worst days of their lives, but it doesn't have to be. Thank you.